Hello, my name is Sarah Castile, and I'm here today to present to you my evidence-based education update entitled Recognizing Depression During and After Pregnancy. Depression during and after pregnancy is a problem faced by many women, but is often overlooked by many care providers. The CDC states that 235,067 Americans suffer from depression. 145,225 of those Americans are women. Women are 70% more likely to experience depression than men, and between 14 and 23% of all women will experience depression sometime throughout their pregnancy. The purpose of this education was to provide an evidence-based education update for nurses, ensuring that they are aware of and able to recognize the signs and symptoms often present when women experience depression during and after pregnancy. The research on this topic came to one general conclusion. Antidepressant use can't be declared completely safe during pregnancy and should be used with caution and on an individual case-by-case basis until the postpartum period, when it's easier to treat depression. The implementation of this project took place over a 2-week period at St. Joseph Berea, and many of you may wonder why St. Joseph Berea, since they don't have a maternity unit. But even though they do not have a maternity unit, they do admit pediatric patients starting at just a few months of age and often care for women that are only a few months postpartum seeking treatment for various health conditions. And during that time, psychosocial and family dynamics assessment is performed, and this is a perfect chance for us to pick up on those subtle signs of depression in our postpartum patients. They were provided a quick reference guide and a copy of the Edinburgh Depression Scale, which has been found to be the most specific when it comes to detecting those subtle signs of depression in postpartum patients. This scale was not a mandatory screening that was implemented, but only a tool for the nurses to use at their discretion. The quick reference guide helped to differentiate signs and symptoms of the baby blues and postpartum depression for these nurses. One-on-one teaching was performed with each nurse, and verbal feedback was given at the end of each presentation. The evidence-based education update was readily accepted, and there was a genuine interest shown by all the nurses involved. The nurses were glad to have this educational intervention because while these patients may be few and far between for these nurses, they are still expected to provide them with individualized top-of-the-line care. If this intervention were to be performed in the future, I would like to do a group intervention versus one-on-one utilizing a PowerPoint or a Prezi. While the one-on-one intervention went great, I felt that at times it was hard to find time during the day, especially if the nurses are busy, and especially at the end of the shift when they're tired and ready to go home. In the future, to make this a measurable outcome intervention, the Edinburgh Depression Scale would need to be a mandatory assessment done on each postpartum patient or pediatric admit. And then we could look at whether there were any new diagnoses of depression with using this scale. Thank you for your time and attention, and I appreciate it and hope that if you have any questions, you will feel free to email me. Thank you.